good to meet you and good to be with you, Annalisa.
This is such an important time, and you offer such important services for our residents who are struggling during the COVID-19 pandemic. I know broadly there are so many assistance programs. What is the most important one that you think people should know about?
At this point, I think I would like to focus on our COVID-19 related programs or services that are available during this period is Medicaid, the Quest program, that is our healthcare insurance program. We have the healthcare program available for our residents who got recently unemployed and are looking for healthcare. They have a couple of options available to them. One option is that they can apply for the federal healthcare at the healthcare.gov at the federal level, and they can also apply for Quest, which is our healthcare program. It's a Medicaid program. They can apply for that as well. We encourage them to apply for at healthcare.gov or apply at our Quest webpage. Apply for it. Don't do your own eligibility. That is one thing I'm urging all Hawaii residents is to not do their own eligibility. Please apply on the federal webpage or apply on the Quest webpage and let us determine eligibility, because the eligibility is very nuanced and very complicated. It depends on the income, household composition, and many other things. So a lot of the recently unemployed or people and people who have got reduction in their hours may be eligible for healthcare insurance from Quest or from the federal exchange.
Is the system available and ready to handle more applications coming in?
There is an increase of close to 40 to 60% increase in the number of Medicaid applications that we have received. And we have already enrolled more than 10,000 Hawaii residents on Medicaid. We have a very sophisticated and very streamlined system to receive applications and to process applications and authorize the benefits. Our system is a modern system, and we can take any load that is going to come to us. It is very streamlined. If they apply online and they are able to provide all the information that we need to determine eligibility, we can turn around disposition within 24 hours. They can go to the specific website for MedQuest, for the Quest healthcare coverage, and that is www.mybenefits.hawaii.gov. Over the phone, they can call in at 1-877-628-5076. And of course, they can send it via mail, US mail to the office that is closest to them. These addresses are available on the website.
And you just mentioned also the childcare services that are still available for people. Tell us briefly about that.
Childcare is a very critical service especially during this time where you have your first responders and you have your essential workers who are providing valuable services during this time. So what we have done is we have expanded and waived certain requirements related to childcare in a normal circumstance that we apply to our programs. We have waived a lot of those either through the federal waiver or through the governor's executive order. It is to ensure that essential workers have access to care. So that information is also available on humanservices.hawaii.gov. People can go there, they can find the information about their eligibility. People can find information about which sites are open today on different islands. We have 100 sites that are currently providing childcare on Oahu. We have 30 sites on Big Island. We have around 15 to 18 sites on Maui and 12 to 15 sites on the island of Kauai providing these services.
They can not worry about what's happening with their children and do their jobs to protect all of us.
I am really very thankful for our provider community to be open and available at during this difficult time, because this is the time where we all need to make sure that our communities are fully supported. We are living through the most unprecedented and challenging time. It required us to be nimble, to be flexible, to be open to creative and innovative ideas so we can be responsive to the needs of our communities.
You actually reminded me of another group that you service or help is the disabled community. Are there specific programs that they can look for to, because again, they are this invisible community people usually forget about, that they can't get out like the rest of us to get the groceries, to get the services. Are there any specific programs designed for them that you can tell us about?
Division for Vocational Rehabilitation, who predominantly serves the blind and deaf population. It is a very important program that we have in the department. They are doing tireless work to ensure that our residents who are either blind or deaf or any other combination, they are getting the best support that they can. So they are able to access services via electronic medium. They are able to come to the offices, even though we are not allowing a lot of face-to-face contact, but some of our case managers are using proper PPEs to make sure that they are protecting not only themselves, but also the clients. And we are also providing those PPEs and other equipment to the clients as well, because this is a vulnerable population group that we serve. Yes, they can get access to various services through independent living or through many other ways. Those supports are continue to be provided. We are continuing to provide those resources to them.
Good. And we'll have all of that information that you mentioned on our website, kitv.com. Thank you so much, Pankaj Bhanot, for joining us, the Director of the Department of Human Services. And thank you so much for you and your team for helping all the residents out there in need.
You're welcome, and thank you for bringing this important message to the community.
All right. And Good Morning Hawaii. We'll be right back. Stay with us.